what do you call them? Boarding houses. One on Monique and the other on, what the hell's the name of that street over there? Have cases. So we added
Oh God.
11 more cases to the 2 we already had today.
Yeah, group
No
home.
way.
Jim, you want to give me Vinny again?
Oh,
Sorry.
no.
I'm wondering if there's any positive. I mean, if there are any one in the house that's not positive, if they need to be relocated. That's a.
I'm telling you, once it hits these older people, it's not good.
Well, these are all younger. How do you say, challenged people?
Yeah, Bruce,
Oh,
it's
it's not-
the
it's-
Evergreen Center, Trish. This is Dennis, the Evergreen Center. They're group homes with children that are handicapped.
Yeah. That's
Yeah.
not in Bellingham, though, is it? That's,
Yeah, they are.
That's
The
Milford, right?
Yeah,
Yep.
the center is in Milford, but there are several homes in where some of the children reside.
Oh, I see.
Monique and Hickson, I think, is it?
Still a lot of people.
Happy Tuesday.
Hey, Tina.
Hey, Tana, how you doing? Missing Kelly. There she is.
Here I am.
Okay, so I guess we're ready, right?
Yeah.
Okay. Being 7:01, I'd like to open the meeting for the Bellingham Board of Health for April 21st, 2020. Myself, Vin 40, Chair. Vice Chair Trish LeClaire, Member Kelly McGovern, Minutes Clerk Tina Griffin, Health Agent Bruce Wilson, and other guests. Okay, first order of business is the minutes from April 14th. Which are somewhere there.
It's in your packet.
Yeah, I know. Just got to get to it. Okay.
I've already read through them, so when you guys are ready, let me know.
Okay. Okay. How you doing there, Trish?
She's on mute.
She's on mute.
There we go.
There we go.
Okay.
All right. I'd like to make a motion that we approve the minutes for April 14th.
I second that.
Okay, all those in favor say aye.
Aye.
Aye, opposed, abstained, so carried. Okay, great. Next one is coronavirus updates, either Bruce or Esther, whatever.
Well, we had 2 cases this morning, and then during the course of the day, the housing there came in with 5 positive cases and 6 that are undergoing tests, with a possible total of 11 new cases at those 2 locations. We have 1 person that's on the verge of dying, so that would make our 3rd death.
So sad.
We're still climbing. I guess the bright side of that is they're all in confined locations rather than being all over town. So, I mean, I guess if they're gonna get it, it's gonna spread through there pretty quickly.
Okay, we got another DPH distribution.
The other check came in. I gave it to Mary so she can put it in.
Okay. That's good. We'll have to put together a list of things for that, right?
Yeah, put a bunch of stuff together. She was gonna work up a breakdown of where the other monies had gone. So as soon as I get that, I'll forward it to you guys.
Okay, great. Okay, Moving right along, 7:30, it says Earth Day updates. Way ahead of that, so.
So we've got that posted on social media, and hopefully people are out there in their neighborhoods, and we look forward to anybody that takes a picture so we can send them a nice T-shirt, right?
Yes. So it's all month long, and we may
Did you put it
hold
up on
one.
Facebook? I'm talking to myself over here. I didn't know it was on mute. Did we put it on Facebook?
I believe it's on Facebook. I think Tina, Tricia did it, or somebody.
Yeah,
did.
so I had
Nothing
put-
about t-shirts now.
No, I didn't put anything about t-shirts because I thought the last meeting we talked about re-looking at this in May and hopefully things would be different, and trying to get the community involved and give out the t-shirts then. But I think we're a little confused on what the plan was.
Well, I think I had mentioned that since everyone's home now, now's the time to get people out and cleaning up, but I don't care either way. The whole thing's screwed up this year anyway.
Yeah, I did see a couple of people on Cross Street and Lake Street picking up. Both ladies were part of the group last year, so there are people picking up, so whatever.
Hey, I want a cup like Dan has there. That's a hell of a big cup for coffee.
Are you sure it's coffee?
Yeah, this late at night though, I don't know if you need coffee, right?
It's iced tea,
Oh, it's iced tea, okay, good.
and I'm off duty.
Is it Long Island iced tea?
Yeah, exactly.
Rhode Island iced tea.
Okay,
Show 'em
There
the
you
cup,
go.
show 'em the cup, Dan. That thing is huge.
But enough about me. Continue.
Okay.
at least that won't keep you up tonight, that's good. Okay, so complaints updates, anything, Bruce?
Just a couple. I had somebody go through the drive up at DQ, and I'm going to reach out to the board to make a suggestion that we start to require masks for all employees, because the woman was horrified that nobody in DQ was wearing a mask and had gloves, and took her entire order and threw it in the trash.
Okay,
But right now, it's just suggested, it's not mandated anywhere, and I wanted to ask the board what their take on that is, of whether we should be looking for everybody to be wearing a mask now. It's, specifically like the markets, Walmart, Market Basket, Whole Foods. I mean, that's the biggest area where people are going to be exposed, and to protect everybody. I don't know. What's
I think
the board?
I think that's a great idea, Bruce, because it's probably going to go that way anyway. So why not be ahead of the game?
proactive,
Kelly?
Always try to be proactive.
correct. Okay, maybe you can reach out to them and some of the other stores and say, you probably should have the person at the drive-through serving people with gloves and a mask, so. Does it-
I mean, the gloves aren't as important as the mask.
The mask, okay, that's fine.
Kelly, what's your thoughts?
Is she muted again?
No.
I mean, it makes sense. I don't know what what is it, just a suggestion at this point? I don't even know.
Yeah.
For food, I'm surprised that it's just a suggestion when you're dealing with food, but
Right.
Okay,
Well, food and stores. I mean, Rhode Island's already doing it.
Anywhere where people are interacting with the public.
Yeah, I guess the gloves at the restaurant, and like if they're serving food, obviously that makes sense because I wanted them to do that way ahead of time. So honestly, they should be wearing gloves already.
Because I did go in and intervene on that. Anybody who's preparing or handling, actually touching the food product, wears the gloves. I see Rob is here too, so he can chime in, because I think I've sent it there a few times. So they do wear the food when they're making burgers or something in the back. But when they're making the ice cream or something like that, everything is in a paper container. So they're holding or touching the paper and not the product itself. So that therefore they're not touching the food.
Well, the paper doesn't cover the entire cone. Doesn't cover underneath, doesn't cover around. So when they're holding it, they're still touching it, and you eat the whole cone.
true. So, Dan,
I couldn't find the virtual raise your hand thing.
okay.
As far as I know, Bruce, you spoke this morning about you get the store owners are concerned about their employees because people are coming in shopping without masks.
Yeah, that too.
Concerned.
Both ways.
So if we're looking for the masks, if you guys want to institute a mask, I know, like I think
Mask
Chris said,
mandate.
if it's up to you guys if you want to do that. It's not the end of the world. People go in, and we're doing it to protect the employees as opposed to protecting the shoppers. As far as the gloves go, and I don't think is Esther not. She's not here.
No.
But the gloves, it's to me, it's an exercise in futility because people aren't using gloves properly.
Correct.
They're wearing the gloves, they're touching everything, then they're taking their mask off their face with their gloves. And I mean, I think we just really push more of the, sanitizing your hands, washing your hands. But if the companies, the grocery stores are concerned more about their employees, I don't mean this to sound the wrong way, but they're more concerned about their employees being protected than the shoppers, and you guys want to institute that, I mean, that's something to consider.
Okay.
I think we should just make it across the board. Everyone should try to wear a mask, make it mandatory. If you're going into going into stores or if you're working in a food industry, everyone should have one on.
Okay. So Bruce, why don't we draft something up and take it around and say, we're going to mandate that.
Is that going to include takeout orders too? Delivery to your house?
Yeah, they should. Are they delivering to people's houses?
Yeah, I got a pizza last night.
Oh, they are?
Yeah.
I don't know. I haven't ordered out.
Yesterday was my first time. I got a pizza yesterday.
No.
Well,
I think anyone
look at,
handling food.
yeah, if someone coughs on it, well, it's still in the box, but even then, you don't know if it got coughed on before you got it. So might be good seeing the mask. You'll at least feel comfortable. Even if it's not working, you won't know. Better than if you don't see it. You can see that there's a potential source of contamination to your food. Whatever. Okay, so see, we got Robert here. What about food inspection reports, Rob?
So actually, there was a couple things I wanted to run by you. I'm going to be doing a bunch this week, just kind of making a list of everyone that's open. But I wanted to see if it would be okay for me to do the paperwork electronically, if I could go in with just my iPad or phone and kind of type everything out and send it to them for electronic verification. That way we're not all handling the same paperwork, trying to make copies and all that to try to streamline things.
Makes sense.
I had found a couple different softwares that were online. They're a little bit pricier, but in the interim, I can put them in DocuSign. I have access to it, so I can put them in DocuSign. I already made the template for our documents, so I'll fill them out during the inspection. It'll go to whoever the PIC is for just an email verification to sign it, and then once it's signed, it should get forwarded to everybody on the board. So I apologize if you get bombarded with emails, but I just wanted to make sure that that was an acceptable use for now. So it would go to the front office. So the office would have a copy, Bruce would have a copy, and then everyone on the board as well.
That sounds like a
Sounds
good
good.
idea. Yeah.
And then I did find a software. I know that we have been talking about Bruce with the iPad and everything, and that we have a software already for the Board of Health. I found a software online called, I think it's Food Code Pro. And it's actually kind of the same thing where everything's just online. It's all the forms, but it has the whole database of the code violations right in the software.
That's nice.
And it also has an option. So if I see something during inspection, or if you go on an inspection, Bruce, and see something, you can actually take a picture and attach it to the violation so everyone sees it. And it keeps a
That's
running
great.
tab of everything.
Let's hear it now. What's the cost?
It's $150 a month, but they have a grant to pay for it. So I was going to look into how to get the grant.
Either that, or we could use money maybe from this thing here, since we're having to go protect everybody by not having paper handled by everybody.
I don't think we're going to have anything left, Vinny.
Well, that's true.
Have you seen
Well,
some
no,
of
no,
the
I'm
bills
saying
coming
out of
through?
the 10.5. Are we
Yeah,
talking
that's what I'm
that?
talking about. Have you
Oh,
seen
okay.
some of these bills coming through? We haven't gotten to the
Okay.
next thing on, well, two things from.
We'll talk about that in a few.
yeah.
Okay, yeah, I think we should do that, Rob. And,
Well,
you know.
we're not gonna do the software yet.
Well, he's
Right.
gonna apply
No,
for
I'm
a
just gonna look
grant,
into the
so.
grant.
Yeah, yeah.
Right.
Okay, fine. Okay, fine. Okay,
Rob, come see me when you got a minute. We'll take a look at the grant paper. I'm pretty good with that stuff.
Okay, sounds good.
okay. So next thing was essential businesses. I guess we had a few people contact the state, and Bruce contacted the state, and you know, they're holding the line with, you know, the way things are going. Hopefully on the 4th, we might open up. Hopefully we don't go to June 4th, but I don't know. It all depends if we hit the peak on Thursday or Friday, which is the new 20th is the 25th. So I think that's Friday. So who knows what'll happen, but we'll see what happens, you know. The decision is still May 4th when the governor will announce what he's doing. Although he did jump ahead and say schools are closed throughout the rest of the year. Doesn't mean though kids aren't going to school. They got to do virtual classes. So we'll see how that goes. Anyway, we don't have a teacher here, so we can't ask him how that's going to go, but whatever. Bring that up tomorrow morning. Anyway, so the other thing was, I guess, bills. Kelly, you want to talk about
Yeah.
billing?
Got just payroll, but I just wanted to ask Bruce or even Laura if you guys know. I know she's doing a lot of work, but Esther's got 12 hours for one day of work.
Yeah, you should
You're on
see.
mute. You're on mute, Laura. There you go.
That was for a day that we didn't put in because it missed the payroll, so I just put it all on one day.
Okay.
Okay.
So I did notice that. I was like, how can you do 12 hours of work? So,
Bruce, is she still working full time?
She's trying to.
Because I'm just I'm wondering how she's doing 80 hours a week. It seems like a lot.
yeah.
She's put in have you gone? I don't know if you've been on into Maven, but she's got a lot of tracking and tracing right now.
I mean, there's a lot of people in there, that's for sure.
She's we got, let's see, 43 cases, 20 I think have returned, and then of those cases you also have the quarantine people as well, which is tracking.
Mm-hmm. So how does that work actually? Does she track them every day? Does she see how they're doing? Does she have to call them? Like, how does that work exactly?
Yeah, she's checking in with everybody just about every day. The ones that return the calls, not all of them return the calls, but
Even 6-7 hours a day seemed high to me, but I don't know. I don't want to assume to know what she's doing for a job. I never want to do that, but it just seems really high. She's making more than you, Bruce, right now.
cool.
Go ahead.
I have no problem with that. She's putting a lot of time in.
Dan's got his hand up.
I'm trying to follow protocol, and if I'm intruding too much, you guys just tell me.
That's fine. Go ahead.
Keep me muted. Actually, I was going to bring this up tomorrow at the 9 a.m. meeting with regards to the tracking. I know there's some towns that are actually using school nurses who are aiding the public health nurse with some of the tracking and maintain, checking on patients and reporting in on the current positive cases. So I don't know if that's something. And there's no school representative here, so I don't want to sit there and speak on behalf of them. But I don't know if that's something we should look at or
Right.
to help her out.
Dan, real quick, does school nurse get technically paid now because she's salary, right? So if we
I think
use her,
so.
we would use some of the school department nursing monies to aid Esther. I guess. I don't know how that goes.
Yeah, I'm not sure. Yeah, and again, and that's why I'm not. There's no school representatives here. But if it comes to the point where Esther's getting overwhelmed, if there are some other professional nurses that are employed in town that can help out, and I'm talking, you're checking on current, positive, what's your temperature today? Is a lot of that the checking in, checking on, they're doing temperature checks and symptom checking. So I don't know, just something I saw in the news that I think Methuen was doing it, Melrose was doing it.
I just don't
just
think
an option.
I just don't think it's healthy for anybody to work 80 hours a week.
Yeah, well,
Never.
You're
That's
right,
the
Tracy.
thing. Like,
Right.
if she's really working 80 hours a week,
And I do
That's
think a
crazy.
chunk of that is the attending the emergency committee meeting, the live broadcast. That's taking up a lot of her time.
It's not
Yeah,
that.
that's at least-
That's not
I mean,
even an hour.
yeah,
That's
some of
not
them aren't,
typical.
but some of them.
But I'm saying with the follow-ups and all that, it is a good chunk of hours if you put them both together.
And then let's ask, maybe, if you're doing, if you get a new positive, you have to do all the contacts with that person
Right.
too. And that means chances of getting every family member to say, I'm here, I'll talk, It could be tracking them down. There's a lot of time, calling here, calling there.
I mean,
Yeah.
I don't know. I'm not sure.
The Zoom meetings start at 9 and go to like 9:30, but between 9:30 and 10, we're preparing for the second Zoom meeting,
Right.
and going through the list of questions and stuff. So I mean, basically she's on the clock from about 8:30 to 10:30 or 8:30 to 11, depending on how long the meetings go. Because I mean, a lot of it's based off her comments and knowledge and
Well, keep in mind that that money that we got in is going all to Esther, just so everyone knows where that money is going. There's
Okay.
not going to be anything left over for the software that we were hoping for that food inspection. So just FYI.
No, but let me work with Rob on that. I think we can probably pull that off.
Yeah, I have a phone call set up tomorrow with the sales rep that's gonna kind of give me the information on the grant.
Well, I know, Bruce, you had said before that we might need to call someone else in to help Esther. So I think Dan has a great idea if that would work.
When
I mean, it gives the school nurse something to do too. I'm sure she's bored out of her mind, or close to it.
Yeah, when we talk to Esther in the morning or tomorrow, we'll mention it to her. And Dan, are you in the meeting tomorrow, or is that one of the associates?
I'll be virtually in there. I won't be in studio, if you will, Bruce.
No, but just if I forget, just remind me, and we'll ask her, because I know she's got a big heart and probably won't say she's being over text, but it does put some wear on you those hours.
Well, and that was my point. And I'm not for 1 second questioning Esther's hours and dedication by any means. I think she's, I don't think I even knew who she was until about 4 weeks ago. And now
she's
realize,
very new to our staff. She's very new though, Dan, so that's not your fault.
No, I know, but I'm just saying, but she's like very integral. And I know it's like, well, she's working a full-time job as her primary position. And so I don't want to question, if she's working these hours. I'm fully, confident she is. But if we have resources that can be used, then let's use them, in my opinion.
Right. Absolutely.
Well, again, when I saw 12 hours for one day, that's the only reason I brought it up, because I was like,
oh yeah, no, I get that.
That
I mean,
was
Kelly,
2 days.
there is 24 hours in a day, so that's only a half a day's work.
No, but
slacker.
She didn't get it timed over to Laura quick enough, so we had to catch on the next
I get
round.
that.
Yeah,
that's fine.
I get it.
The other thing to bring up on monies is whether we try to pursue for the fall, it won't happen now, or for the late summer, whether we do planning as a, the middle school as a backup overflow hospital facility. We don't have anything written. We have sort of sketchy plans from the state. I'm not sure if Louise is here tonight, but anyway, I think they said we need. No, I don't think so.
No.
In any event, we need to decide, what she's going to write, if she's going to use a format to follow, or she's going to go from scratch, and then what's it going to cost. So I guess we need to,
We need to have this plan in place anyway, if not for
Right.
this, for the future.
Correct.
So let's get a price.
Okay, fine. Okay.
Yeah,
I'll do
get a
that
price
then.
and then I'll look at the budget with Laura, see if there's somewhere we can
Okay.
vote.
Well, maybe there'll be a third round of money. Who knows, right? I don't know.
I'm hoping so, because I did fill out paperwork. The next round would come with a joint effort from 4 different towns, so.
Yeah, okay, good.
But that's a considerably bigger check, but it's gotta go 4 ways.
4 ways, yeah. Okay, so, well, that said, Mendon, Medway, and Franklin still have got 0 on their second round, so I guess they don't need the money. Or they don't want to put in the work, so our town at least is proactive that way.
You gotta be diligent and look at the meal. And Laura and I look at everything.
Right, right. And it's good, you know. We were the leaders in the septic program, we're still on it, and a lot of towns went away, so we're still getting money for our residents that way too. So, okay. Next item is betterment loans.
There are three apps in the package.
Okay,
All right, so the first one I'll do is 346 Teresa Road. That's the one that we did last week, but we didn't want a motion on because it wasn't on the agenda. So it's on the agenda tonight. So I'd like to make a motion to approve the betterment application form for 346 Teresa Road as submitted.
Okay, I second that.
okay, all those in favor say aye.
Aye.
Opposed, abstained, so carried. Okay,
I
next
have
one is,
a problem with 60 Pickering Ave though.
okay,
We have a W-2, but not a 1040.
oh,
It has to show adjusted gross.
okay,
The other thing is his W-2 has an address of Berkeley, Massachusetts, and not Bellingham, and this is for primary residences only.
right, right.
So
Okay.
those 2 things. All right,
So I think we're gonna have to hold on
we'll
Pickering,
hold off on those 2. Yeah, on that one.
that one,
And
until we
then
get to 1040 and find out where he really lives.
we need to have his get his license, I guess, to show where his primary residence is.
Yeah.
All right, so the next one is 121 Center Street.
Correct.
I have the 1040 on that, well within our requirements. And so I'd like to make a motion to approve the betterment application for 121 Center Street, Bellingham for septic.
Okay, I second that.
All those in favor say aye. Aye.
Aye.
Opposed, abstained, so carried. Okay, great. So I guess that is our agenda. Does anybody else have anything else? Okay,
Tricia,
Hey,
you wanna-
Vinny.
Yes.
Next time I do the parking lot perusal, I want you to come along. I think it's a double tag team, so we
Okay.
can get that. I missed out on 3 different spots. I drove by, I saw the people with the gloves on. I went down the next row and the gloves were off and on the ground and I missed it.
okay.
Man,
It's like,
I don't understand why people are wearing gloves. They should not be wearing gloves. It's putting them more at risk than not. If you don't know how to use them, don't wear them.
Right. But I
mean, in
think they put the
healthcare,
mask
you're-
on, they went with the gloves automatically. It was like, I don't know, might have been suggested by somebody.
just want to catch one and make them clean the parking lot. Oh,
Right, yeah. Love that.
Did you have a question, Dan, or are you signing off?
Yeah, I'm just trying to get my unmute. No, I was with Trish. Sometimes it gives people a false sense of security when they're wearing gloves or the mask, and if they're not using it properly, it's just like I said, an exercise in futility. So it's kind of
It
like
puts them at higher risk.
right.
Correct.
They think they're I have gloves on. Nothing can hurt me now. It's
Yeah.
like,
And then they pull
Oh.
the gloves off by the
With-
fingers.
Right.
or the teeth.
Or the teeth.
Yeah.
And then they don't wash their hands after.
Yeah, exactly.
Right. Yeah.
So that's
And
just
they
me.
touch their eyes. There it goes.
Yeah.
Now I have to scratch my eye, Vinny. Thanks.
I know you're like paranoid to touch your face on these things. Don't want
Yeah.
anyone to see you.
Well, the good news is we're in their house, so shouldn't be any COVID following me around. I'm looking over my shoulder. Okay,
Yeah.
just junk.
Anyway, it was nice seeing everyone.
All right,
What?
don't forget, everybody wash your hands after
Right.
here.
All right, I'd like to
Yeah,
make
I
a
have
motion.
I have a
Okay.
great little post I'm going to post on our Facebook that one of my doctor friends shared about the mask and how much it protects you and people around you. So it'll kind of go with what we want to do with the markets and the restaurants.
Good, okay.
Thanks.
All right.
All right, I'd
I'll-
like to make a motion to adjourn.
Oh, I second that.
Okay, all those in favor say aye. Aye,
Aye.
opposed, abstained, so carried. We're
Good
adjourned.
night, everybody.
Thank you,
Thank you.
everybody.
Good night, everybody.
Bye.